Your name?
Merrill Goozner.
Your professional position?
I am a freelance journalist and blogger at gooznews.com.
Spell that.
GOOZNEWS.com.
And what do you focus on?
I write mostly about healthcare issues, both focusing somewhat on the healthcare system generally, also the drug industry in particular.
What does the drug industry have to fear from single payer?
From single payer, probably it depends on how it got set up. If it was set up the way the Medicare Modernization Act that created the prescription drug benefit was set up, which provided a drug benefit for senior citizens, it would, where they weren't given the right to bargain for lower prices, then they wouldn't have anything to fear. But of course, economically, if you had a single purchaser who could operate in the drug arena, they could negotiate much lower prices.
So prices would drop by how much compared to other single payer countries, let's say?
Well, it's very difficult to make those kinds of judgments in advance. You would have a powerful monopsonist buyer in the marketplace. You would have an oligopoly, which is what the drug industry is really, where you have patent protection, which a limited number of entries in every class of drugs. So it would be more of a fair standoff than you currently have, where the drug industry has inordinate pricing power. So, but to predict what the drop in prices would be virtually impossible. Any economist who tried to claim that would be blowing smoke, in my opinion.
Do you support single payer?
Yes, I do generally. I mean, I'm sort of like the president. I mean, if you were starting from scratch, that's exactly the kind of system you would want to set up. In the vast majority of advanced industrial countries who established national health care programs after World War II, they went to single-payer systems. There are other models to do it, to have universal health coverage. I think that given where we are today in the United States, however, it's politically very, very difficult to move to a single-payer system.
Well, that's only because, I mean, he says, at the AMA, he said it was because, a lot of Americans don't want to give up their health insurance. But the reality is, there's the beast in the room, which is the health insurance industry, which would be wiped out.
Well, if you went to single payer, you would not have the health insurance industry selling policies. Absolutely. They would be the big losers under such a system. The mythology around the system is that it would somehow hurt providers. Well, if it was like Medicare, there's no reason why you wouldn't still have a fee-for-service system. I don't think that's a very good system either. I would rather see a transformation of the delivery care system as well.
So to a UK kind of system?
Well, I don't know that you want to go to a national health service model. There are other models. I think what we need to go in this country is towards a salaried physician model operating in prepaid group practices. There's a number of different ways to set that up. We have a number of great examples, homegrown here in the United States. Organizations like the Mayo Clinic, like Group Health in Seattle. Now, these are not perfect organizations, but they certainly deliver much more effective health care at much lower cost and much higher quality than the current fee-for-service system. I think one of the great flaws of our current debate is that there hasn't been enough attention given to the delivery system problems that we have. Single payer would be a way of driving delivery system reform. It's not the only way to drive delivery system reform.
But the ideal, I guess, would be single payer on the insurance side, salaried doctors on the delivery side.
That to me, I think that the fee-for-service model is really, truly one of the great problems that we have today. It turns every doctor into a piece worker. And manufacturing learned long ago that when you have people on piecework, you get low-quality output. Why we continue to do this 30 years later in our medical industry is beyond me. That said, you can make that transformation under a number of different insurance models. Single payer is one way and a very efficient way to drive that change. But it's not the only way.
All right, last thing. The CBO just scored Kennedy's plan, which is the most liberal of the tinkering plans, and found it's going to cost $1 trillion and still not cover 37 million people. They still have not scored the single payer plan. The single payer advocates say if they score single payer, it wins hands down because it covers everyone, and we're not spending any more than we're paying now to cover everyone, because you wipe out the insurance industry and save $400 billion.
There is, I think, I think there's a good reason to believe that the administrative efficiencies on a initial startup of a single-payer system could well pay for insuring all the uninsured. I think that that's an accurate statement. The problem, though, is that, and I've argued this on my own blog, is that single payer, the Medicare system, as one type of single payer that we have out there, because single payer is, after all, what some people call Medicare for all. Medicare cost inflation has really been no different than the private sector for the most part. There was within a point or two, year after year. Sometimes Medicare is higher, sometimes the private sector is higher. But the problem of healthcare cost inflation and the drivers of that, which are the underlying delivery system issues we have, in which we have people doing piecework, delivering ineffective care just in order to run up the bill. Unless you tackle that, going to single payer might have a one-time administrative savings that would enable you to pay for insuring all the uninsured, but we would still confront a very serious problem of healthcare costs rising at twice the rate of inflation every year. And we really do have to end that if we're going to have a sustainable healthcare system under whatever model we move to.
Okay, so we need not only single payer, but an enlightened single payer.
Right. I think Dr. Arnold Relman has a piece actually in this week's, the current issue of the New York Review of Books that I would recommend to people. It's probably freely available online, in which he really discusses the need for healthcare system delivery reform. His most recent book, A Second Opinion, really goes over this model in depth. And for those who don't know who Arnold Relman is, he's the former editor of the New England Journal of Medicine, going way back into the 70s and 80s, and I like to refer to him, when I write about him, as the doyen of analysts of our healthcare system and the problems in the system. I can't stress enough to single-payer advocates, and really to any healthcare reform advocates, including people who are in the HCAN coalition and people who are pushing for the public plan, for instance, and other incremental types of reforms that they hope will improve the system, that not enough attention has been paid to delivery system reform. And that in the years going forward, any system that gets established out of this reform effort, or no change at all, is going to force all of us to confront that issue. We simply can't sustain healthcare costs rising at twice the rate of inflation year after year after year after year. It's sapping the rest of the economy. It's eating up workers' wages increases to the extent they get any. And so we really have to deal with that issue.
Thank you, Merrill.